Thank you very much. Before I deal with today's momentous news with the confirmation that the Pfizer biotech vaccine has been approved, I just want to take an opportunity to congratulate the Northern Ireland women's football team, history makers as they are, and wish them well for the playoffs next year. They really did give everybody a sense of hope last night. And of course that continued this morning, and the news that we've been waiting all year for, yearned for actually, the virus coming under control with a vaccine in a safe and effective way and protecting us from COVID-19. Our task now is to deliver our vaccination programme as soon as possible. It is the breakthrough that we've all been hoping for and praying for, and this is our pathway back to normality, back to a world where we can hug our wider family and friends, able to mark major life events together, both happy and sad, and where we can freely enjoy travel and leisure activities and work and socialise with colleagues. I do want to pay tribute to the medical and scientific communities who have provided this pathway out of the pandemic, and to all of those on the front line who continue to fight a daily battle on our behalf against this deadly virus. This is our pathway out, but we must walk all of that path. Until we reach its end, we must all keep to the public health advice. People can't drop their guard. This is not the end of the fight against COVID. No one is yet protected, and the virus is just as dangerous until you receive the vaccine. The full protection of the vaccines will take well into 2021, and of course this has undoubtedly been one of the most challenging periods of our lifetimes. But we have a common goal, and that is to preserve both lives and livelihoods. We have had to take some difficult decisions in order to protect both, and we said at the start that we will get through this together, and that is as true now as it was 10 months ago. It is this renewal of our spirit of hope that is the most welcome of gifts as we head towards Christmas. We are the first nation across the world to reach this point, and I'm very proud that we will all equally benefit here in Northern Ireland and right across the United Kingdom in this mass vaccination programme. And as we receive this good news in the battle to save lives, we have more good news in the battle to save livelihoods. The Economy Minister, Diane Dodds, will launch a new £10 million scheme for newly self-employed who have been adversely affected by the pandemic. Diane will be providing the full details around eligibility and delivery of this new help, and those eligible will be entitled to an initial grant of £3,500, topped up towards the end of the scheme as appropriate. It's important we do all we can to support all those who have borne the brunt of COVID in so many different ways. And we know that we're not at our end destination yet, but we can now feel confident and optimistic that we will get there. Furthermore, new targeted rapid testing will commence, and this will give thousands of students and their families the assurance of a safe return home for Christmas. There are a number of UK-led programmes underway in education settings across Northern Ireland, and I would encourage all those who are eligible, both students and staff, to take part. With these new opportunities, we must be able to use them all, and there's much hard and difficult work still to do, and that's why we have established that new COVID-19 task force. It will operate at a strategic level and bring together the vaccination programme, the development of new capabilities in rapid testing, and our work on ensuring compliance with the health regulations. This is about ensuring that we maximise the benefits of every advance, get life back to normal, and tackle the harmful legacy of COVID on lives, on communities, and on jobs. Patricia Donnelly, head of the Northern Ireland COVID vaccine programme, and her colleagues have already carried out a substantial amount of work, and they will be able to avail of additional logistics expertise that the task force can provide. And I do want to pay tribute to the vaccination team, of course, under the supervision of Michael McBride. I think they've done some tremendous work, and we've been briefed on that work last week at the Executive. Northern Ireland will receive our 2.85% share of the UK total, and when I spoke with Health Secretary Matt Hancock this morning, he was clear that we would all move together. 16,000 care home residents and their 32,000 staff will be vaccinated in the first phase here, along with our 71,000 health and care staff and those aged 80 years or over, of which there are just over 80,000 in Northern Ireland. The programme will continue in stages, decreasing by ages and clinical risk. Work has been ongoing on the pathway, and when the new 2 weeks of stronger restrictions come to an end, we will see that taking effect. The Executive will discuss this tomorrow. We want to give the public as much advance notice as possible as to how we come out of the current restrictions. Of course, there remains much to do, and I urge every person in Northern Ireland to join with us to get this done. Let us keep on this path now before us and get back to our very much looking forward to getting back to our way of life. Michelle.